Hello everyone. Thank you for joining us today for the Associate Dean for Academic and Student Affairs candidate presentation. I'm Michelle Kuba. I'm the Assistant Dean of Operations here at the school, and I'll be moderating the session today. Dr. Madiha Abdel Maksoud will be presenting, and then there will be some time at the end for questions. So please enter any questions into the chat, and I'll be happy to read them. With that being said, I'm excited to introduce Dr. Madiha Abdel Maksoud. Dr. Abdel Maksoud is a public health educator specializing in global health. Dr. Abdel Maksoud received her medical degree from Tanta University School of Medicine in Tanta, Egypt, and her PhD in epidemiology from the University of Colorado. She's currently an associate professor in the Department of Epidemiology and Pediatrics. Dr. Abdel Maksoud is the director of the MPH concentration in epidemiology and the school-wide global health concentrations, and the chair of admissions policy committee of the Colorado School of Public Health, and the director of the global health track at the CU School of Medicine. She's also a senior investigator at the Center for Global Health. Dr. Abdel Maksoud taught, practiced medicine, and did research in Egypt. She completed a postdoctoral fellowship studying the racial ethnic differences in obesity and its biomarkers, and received the Rolls-Simon Award from the Obesity Society for her work. Her current research focuses on refugee and immigrant health and promoting growth and development of children in low-resource settings. Dr. Abdel Maksoud has an extensive expertise in curriculum design and reform, competency development and revision, and establishing partnerships to create impactful domestic and international experiences for public health and medical students. She has developed, taught, and co-taught numerous courses both in the U.S. and abroad, and she is a recipient of the University of Colorado President Teaching Award. So thank you, and I'll hand it over to you.
Thank you very much for the introduction, Michelle, and good morning, everyone, and thank you so much for being here with us on Zoom. So the title of my presentation is From Orientation to Graduation, a Vision for Academic Success, and here is what I'm going to talk about. I have been with the school for 16 years as a faculty member, and before that, as a graduate student. So I've had the pleasure of interacting with so many colleagues at the school. But for those of you who don't know me, I'd like to give a little bit of background about myself, the current roles that I currently hold at both the schools of public health and medicine, my commitment to diversity, equity, and inclusion, and some of the activities that reflect that commitment, my vision for the role and the key strategies to achieve this vision. And then I would like to discuss very briefly a very important publication by ASPPH that was released in March that talks about guidelines and recommendations to improve public health education. I'd like to talk about my vision for curriculum reform and the key steps for that. And then I will end with strategies to increase student enrollment, completion, and support. And of course, at the end, I'll be happy to take questions. So as Michelle said, I went to med school and finished my clinical training in Egypt at Tanta University School of Medicine. So this is my alma mater right here. And after graduation, I served in rural Egypt as the co-director of a rural health center. And after finishing serving in rural Egypt, I joined the faculty of the Department of Public Health, Preventive and Social Medicine at the same institution where I did my medical training. I got my master's degree, taught, practiced medicine, and did research. And then I applied for and got selected for a scholarship to study epidemiology, a doctoral degree in epidemiology from the US. So I came here, finished my degree, and then worked overseas again for 4 years before coming back as a postdoc and then as a faculty member. The depth of international experiences that I had throughout my career allowed me to contribute uniquely to my global health work and the global health programs that I lead. So these are my current roles. As Michelle said, at the School of Public Health, I run the epidemiology MPH concentrations and the school-wide global health programs, MPH and certificate. And I also chair our admissions policy committee. And at the School of Medicine, I run the global health track, and I also run the international electives. And the way I lead these roles is very complementary. So they serve each other. So through these roles, I've been able to team up public health and med students to work together on practicum and capstone projects. And through the partnerships that I developed in both schools, I've been able to offer an annual global health fair, which is a showcase of all the domestic and international global health opportunities that we have. And through the global health fair, a lot of our students, public health and med students, have been able to do their practicum, capstone, or do research and service abroad. Through the leadership roles also here at the university and before, I learned a lot of valuable skills, not just as an educator, but also in budget, management, and fundraising. So I would like to talk about how my current activities fit within the role of the Associate Dean for Academic and Student Affairs. On the student affairs side of things, I do a lot of outreach. I have been, and I'm listing here just a couple of examples of what I do. I am the CU representative on the Colorado Welcome Back program. And for the folks who don't know what the program is, it's a program that helps foreign trained health professionals to get integrated into the US health workforce. And through this program, we had at least 5 trained professionals who did their MPH with us. I also do outreach with other places. One of them is Kuwaiti consulate in the US with the director of education in the consulate. There was a very successful model from CU Denver where the former director of CU Office of International Affairs did an outreach with the Qatari government. And since then, they've been sending their students to CU Denver. And I'm working on a similar model for our school. I also have been the driver of our online epidemiology MPH program. We only have 2 courses that are currently in that program, in that specific program, that are not available remotely. So I've been working with my department chair and the biostat chair to make one of these both of these courses available online. The chair of biostat graciously accepted to offer another section online, and we're working on the final course to be available online. This is really a huge diversity, inclusion, and equity matter because we are seeing a surge in international applications. However, a lot of the applicants don't end up coming. And one of the reasons is visas. They are not able to get visas. But even for our domestic students, living in Colorado is not cheap. And a lot of our students work full time. So that will definitely open doors and make the program more accessible to folks who cannot be here in person. I participate in a lot of open houses and orientations. And of course, I'm a resource for prospective students. So I meet with a lot of folks who are interested in our programs to discuss the programs and answer any questions they have. On the admissions side of things, I chair our admissions policy committee, and I'm incredibly proud of the work that Laura Hager and other colleagues on this committee do. Again, this is not just a committee that reviews policies and procedures in relation to admissions to our programs, but it also ensures that we're equitable, diverse, and inclusive. And I'll talk about that more. I reviewed MPH applications and DRPH applications in my program, in my department, and I hold yearly orientations several times for epidemiology students, and I do an annual orientation for global health students as well. So I mentioned that I lead several academic programs. And as you may imagine, I spend a lot of time on course development and teaching. I've taught both in the US and abroad, in public and private institutions, to public health students and med students. And advising is an area of focus that I'm really committed to improving. I have been training my colleagues, the advisors in my department. I hold training sessions, and I developed a comprehensive advising manual that I was asked by colleagues from other concentrations to use. I have been mentoring and, most importantly, advocating for students. And I participated with competency development and revision, the last 2 cycles of our school reaccreditation, and currently I'm involved also in reaccreditation activities at the School of Medicine. I have expertise in curriculum reform. For the past 6 years, I have been involved in 2 important pieces related to curriculum reform with the School of Medicine. One of them is through serving on the Health and Society Steering Committee. Health and Society is one of the 3 pillars in the new curriculum at the School of Medicine. And the goal of the committee is to ensure that we graduate future physicians who are system thinkers, who can promote health equity and population health through advocacy and leadership. I also, in my roles, I've developed a lot of partnerships, both domestic and international. And the goal here is to create opportunities for practice-based learning. So one of the partnerships that I created is with Denver Public Schools. And I've been volunteering with Denver Public Schools for over 15 years now. And I'll talk more about a recent partnership that I developed that serves high school students. I also held science summer camps for mid-schoolers during COVID. I'll also talk about that. But the reason that I mentioned both of them is because I think of both of them as direct contact pipelines. That's like a pathway for students to apply to our programs at some points. And in fact, I get a lot of questions from middle and high schoolers about the difference between public health and medicine. So this is definitely something that's sparking their interest. And then I mentioned the Global Health Fair already. In terms of diversity, equity, and inclusion, this is something that I'm really passionate about. And all my activities, DEI principles are reflected in all my activities, whether we're talking about teaching, research, service, or public health practice activities. And I'm mentioning a few examples of what I'm currently working on or have worked on. I am the Anschutz representative on our Committee on Racial and Ethnic Equity of the Faculty Council. This committee is tasked with addressing the needs of faculty, staff, and students of color, and it provides guidance on hiring and retaining faculty, students, and staff of color. I mentioned the Admissions Policy Committee, and I mentioned that the work we do on this committee is really very valuable in terms of diversity, equity, and inclusion. And just to give you an example, 2 recent examples. One of them is eliminating the GRE requirement. And for the folks who are not aware, this is something really hefty for applicants from low and middle income countries. It's pretty pricey to be able to take this exam, and most people don't pass it from the first time. So certainly a big equity issue. The other thing that this committee did very recently is expanding the list of countries that are exempt from the English language proficiency requirement, which opened the doors for 17 more countries to be able to apply without this requirement. I mentioned the online EPI, MPH, and there are very successful models from other successful schools of public health about expanding the menu of online offerings. I'm not talking about new programs. I'm talking about even for existing programs, finding a way to make them available remotely. I mentioned Colorado Welcome Back program. This is a program that serves, as I mentioned, foreign trained professionals and all 5 students who joined that I am aware of, there could be more, definitely increase the diversity of our student body. I also did focus groups with international students, and I check in with them a lot because one day I was an international student myself. And I know that international students have additional needs. And one quote from one of the focus groups that I never forgot was an international student who told me that during the first day of classes, one of the professors said, I posted the syllabus on Canvas, so you should read it. And the student told me I didn't know what a syllabus is and what Canvas is either. So just to show you how what the additional needs may mean. And this is just a very simple example here. Practicum with GPS, the partnerships that I developed where my students worked with me to develop public health education to high school students was primarily with the school that had the highest minority enrollment in the state. I'm currently developing a partnership with the International Rescue Committee, and this committee serves refugees and asylum seekers. And again, this is going to be a practicum opportunity for our students to serve the needs of the clients of the International Rescue Committee. In terms of teaching, DEI principles are in every single class I teach or I co-teach. But just to give you an example, I developed a system-wide course at the School of Medicine that's focused entirely on global health and underserved populations. And by system-wide here I mean Anschutz, Colorado Springs, and Fort Collins. I also drafted our first diversity statement in my department that we added in our syllabi, either before or around the same time there was a discussion, school-wide discussion, to add a diversity statement. I advocated for adding a religious accommodation statement in our syllabi, which our current dean has, associate dean for academic and students affairs, graciously accepted to add to our syllabi to let our students know that whether they are celebrating Christmas, Ramadan, or Passover, any religious event, that we're willing to accommodate them. 2 years ago, I also started the conversation to add a land and labor acknowledgement statements to our syllabi at the School of Public Health. And this is a school-wide discussion, so hopefully we will see them added to our syllabi as well soon. So switching gear to talk about my vision for the role. My vision is really focused on fostering a dynamic, diverse, and inclusive school environment that empowers our students to excel holistically, academically and personally, through rigorous and innovative academic programs, holistic student support services and activities, curricular and extracurricular, and interdisciplinary collaboration. And there are 5 key strategies to achieve this vision. The first is student-centered approach. So creating support systems that cater to diverse student needs, including, again, international students. Improving academic advising, which is, again, a very important area that I'm committed to improving. Making sure that both students, faculty, all students, faculty, and staff be aware that we have mental health resources. Sometimes we have resources, but folks are not aware that we have these resources, and expanding these resources if we can. And then individualized support for at-risk students, not just after their GPA falls, but before that. So making sure that we provide extra support for folks who need it. And then meaning extracurricular activities that allow students, faculty, and staff to interact in a meaningful way. Excellence in education, and here I really mean investing in faculty and staff. So in terms of training and development. One thing we all can agree on is that the fast pace of change in education, particularly regarding new technologies, means that the half-life of the skills we have is shrinking exponentially. So it's critical for all of us to learn and adapt. Diversity, equity, and inclusion, again, obviously we can all agree on the fact that we need to promote it more. Everybody needs to be trained in diversity, equity, and inclusion, whether faculty, staff, or students. We have great trainings, but I also know that people are busy and sometimes it's not something on their radar. So it's very important to find ways, and I have ideas about how to find ways to make sure that we're all trained in that. And then ensuring diverse representation in decision-making bodies. I mentioned that I am the CU and Shoots representative on the Committee on Racial and Ethnic Equity. And up until recently, we didn't have an African-American voice on the committee, and we certainly didn't have student representation. So I advocated for that, and we recently just asked one of our students who fills this gap to join, and student voices are very important and very valuable in terms of providing feedback. And then really policy review, kind of like what we do with our admissions policy committee, but school-wide, to make sure that our policies and procedures are inclusive. And then targeted outreach. So looking at the demographics of our students, faculty, and staff to make sure that, again, we have a diverse body of students, faculty, and staff. Engagement and community, and here I mean with student council, empowering the student council and working with the student council to understand needs. At the School of Medicine, I have a steering committee formed of students from all 4 years to help us run the track and decide on the track activities. So student engagement and leadership is very important. And finally, civic engagement and community partnerships. I mentioned a couple that I, as an individual, started, but certainly this is something that we need to do more of as an institution. So this is a good segue to talk about a recent initiative by the Association of Schools and Programs for Public Health, ASPPH, a call to action to redefine and enhance public health education. And it's called Framing the Future 2030. With this initiative, ASPPH released 3 very important publications, reports that I encourage everybody to read, but I'm going to focus on the one that's related to education. Not that the other 2 are not related to education, but given the time we have, I would like to focus on the one focused on teaching. So this report provides 4 very important recommendations that I'm going to attempt to summarize in a few minutes, along with very important guiding questions, administrative questions, and curricular questions to help with strategic planning for curriculum reform. So the first one of the recommendations is related to civic engagement, cross-sectoral collaboration, and community partnerships. And the idea here is to engage the learners in a wide and diverse range of cross-sector collaborations. And the value is to empower communities to be able to address upstream social determinants of health, while also helping the learner, our students in this case, to learn how to work with communities with respect in a humble way, while also understanding policy levers and power structures. So one example here could be interprofessional student groups that work together to do community screenings. And I'll show you an example from my work on the next slide. The second recommendation is related to social determinants of health. And we all know and acknowledge social determinants of health, the role of social determinants of health. But we have a lot of work to be done to move beyond that, beyond understanding, to embracing and acting upon social determinants of health. And this is an area that we all need to learn to execute and act on. The third recommendation is related to active learning and supporting lifelong learning. And the idea here is that there is a shortage in the public health workforce, which means that we need to graduate students who are practice ready from day one. And to be able to do that while classroom discussions could be really helpful and very meaningful, they're not enough by any means. So there has to be more active learning and experiential learning. So some examples here is like simulations, building in the curriculum, simulations of public health crisis or interventions, and having the students work on this, or role play where students play, act out different public health roles, problem-based learning, so providing a real-life scenario and asking students to work together in groups to work on it, and field trips to community organizations where students see how things are, how services are delivered in real life. So I mentioned a partnership that I'm working on with the International Rescue Committee, and they need us to provide public health education. And they told me that they had a van, they could bring the refugees and asylum seekers to us at the school where we provide the education. And I offered the other way, to have our students go there, provide that education there to see how services are provided on the ground. In terms of supporting lifelong learning, which is very important, one way to do this is to make sure that we build in our programs ways to cultivate curiosity for learners to develop, to sustain lifelong learning. And again, I have some examples or ideas how to do that. Finally, assuring ongoing training in evidence-based frameworks, methods, and technologies for teaching and assessment. Faculty always excel in research and in different public health disciplines, but they don't necessarily receive training in curriculum design and development, innovative teaching and assessment strategies, and understanding and learning and applying learning theories in classrooms. We can't really expect faculty to be able to do that if we don't provide training opportunities. Also, shifting the thinking from the typical classroom assessment through exams and quizzes to practice-based assessment, where students develop or work on basically for the assessment to be something that can help, that's practice-based and can help communities meet their needs. So these are a couple of examples that I did, just talking more about them. 5 MPH students from various concentrations worked with me over the past year or so. Using data from Youth Risk Behavior Survey that was Colorado specific, I realized that we have a lot of areas that we can improve on in terms of the health of, or public health of high school students. So health behaviors like nutrition, sleep, physical inactivity, bullying, unsafe sex, dental health, so many areas that we could improve on. So students worked with me on designing and developing lesson plans. Each plan was taught in 30 minutes, and each student was responsible for 3 topics to high school students. So that was an example of it's ongoing. It's an ongoing partnership of civic engagement, active learning. And also we had my students and I had to learn what a Kahoot is, for example, because it's like a pulling game where it depends on how fast people answer questions and whether or not they answer them correctly. And that was the way that my teenage girl at the time told me that they learned best in school. So we had to learn that so we could use it in the classrooms. And the work of our students has been very well received. This is the other example of another example of civic engagement. 3 med students who are now physicians in training worked with me on delivering 2 virtual summer camps during COVID. Summer camps were entirely free, and each camp was about a week long, and we had about 100 participants, middle schoolers, where we taught, and by we here primarily students, how pathogens spread, how to protect, themselves from COVID and other infectious diseases. But we also focused on social determinants of health and making sure that students, middle schoolers, understand that the impact of the pandemic was not the same on everybody. We also included fun activities. So having them do some physical exercises with us virtually, and showing them what happens when you touch a petri dish with clean hands versus dirty hands, etc., etc. We certainly got a lot of interest in learning about public health through these camps. That's the Mango House. I'm not sure how much folks know about this, but it's a shared space for refugees and asylum seekers, where there is a clinic, stores, religious gatherings, restaurants, etc. And our students volunteered with the Mango House, have volunteered with the Mango House to provide vaccination and public health education. And that's just an announcement about our Global Health Project Fair for this year. Again, this is a showcase of the domestic and international opportunities that we will make available for our students, folks who are interested in working on global health projects in the US or abroad. I want to finish, excuse me, with 3 things. My goals, short-term and long-terms, in this role, and then key steps for curriculum reform, and then ending with strategies to increase enrollment and retention. In terms of short-term goal, the first short-term goal, I believe that knowing the team and bonding with the team is very important. And the team here, by the team here, I mean the team in the Office of Academic and Student Affairs. You can't work well with people who you don't know well. And I've had the pleasure of working with most of the folks on that team. But it's very important to meet and understand needs and have honest, in-depth conversations to kick in the role. And then strengthen communication channels with colleagues on our 2 partners institutions, campuses, and then understanding the needs of the team, the needs of faculty, the needs of, again, our partner colleagues on our 2 campuses. Improving academic advising, an area of growth for sure for the whole school. Expanding our recruitment outreach. I gave some examples, but we can do much more than this. Evaluation of our academic programs. This is both a short-term and a long-term goal. And I'll talk about this more over the next slide. And then making sure that we have a user-friendly website, and that we're well-versed in using social media, because that's exactly how our target population get the information from. That's the thing that catches their eyes. In terms of long-term, definitely growing a diverse body of students, and will be more successful if you also have a diverse body of students, of faculty and staff. And this is linked to expanding our outreach, growing our academic programs, and again, especially our online offerings, STEM designation of our MPH programs, and this is very important for international students because it gives them the opportunity to work in the US for 2 years after graduation. Reaccreditation, so to continue to be to continue the reaccreditation and improving our rank, we're in a great place and we can certainly keep growing. And then increasing admission, retention, and graduation rates. I'll talk about that at the end of this talk. And then higher visibility. So, and there are so many ways to be more visible, whether it's attending conferences, and here I don't just mean faculty. I mean faculty and certainly students, and not just attending conferences, but leading conferences and having a strong brand identity. In terms of curriculum reform, and I realize that I have 5 minutes, so I'll make sure to get to that and finish it in 5 minutes, so we have a chance to have some questions. The first step is to always assess the needs. But before I even talk about this is not a process that the associate dean or the associate dean's office will be telling departments or programs how to do it. It's the other way around. It starts from the bottom up. A process that faculty will be engaged in with the support from the AD and the AD's office. Faculty will always know their programs more than anybody. So it's on program directors to identify the needs and guide the development of new curriculum. So the first step is to assess needs. So what is the purpose of doing a curriculum reform? Is it to improve student outcomes, align with industry needs, having a visible focus, or address societal changes? And then reviewing the content, which is something that's not going to be done in weeks or months. So for each program, what are the trends in terms of admission and completion? What are the strengths and what are areas of improvement? And then within each program, and what are the resources devoted for each program? And then within each program, reviewing the content. What classes can be retained? What classes should be replaced? And what classes should be updated? This is a process that will need stakeholder engagement to gather input and build support. And by stakeholders here, I mean faculty, staff, students, alumni, the public health workforce, and community organizations. And then setting clear goals and objectives, and making sure that the objectives are measurable, and that the goals reflect the desired outcomes and address the identified needs. Then next would be the curriculum design stage. And there are so many areas that we can improve on in terms of curriculum design. So integrating emerging topics, climate change or pandemics or other emerging areas, interdisciplinary learning, cultural competency, so that students learn how to deal with different communities, community engagement, and advocacy. We have advocacy as a competency, but we don't really teach our students how to write an op-ed or develop an effective messaging. So we need to give them tangible skills to be able to actually do that after graduation. Experiential learning and technology integration. All these steps need professional development of faculty and staff, commitment from the leadership, and resource allocation. Something that we have to be careful with, giving that resources are not endless, the limited resources. And then implementation and evaluation, so gathering feedback and making sure that we continue to improve any changes we make, and making sure also that our curriculum or curricula are sustainable, meaning that they are adaptable, and making sure that this process happens every few years. So it has to be a cycle where every, so many years, we redo this process all over again. I want to end with some proposed strategies to increase student enrollment, completion, and support. So in terms of enrollment, the best way to market our programs is to give our students a good learning experience. Rigorous, innovative programs, good support, so that after graduation, they become our face. Targeted recruitment efforts, I mentioned that several times in this talk. We need to look beyond what we've been always looking in terms of recruitment. Giving more focus to international recruitment. This is a very important market. And then expanding our online and hybrid programs. And there are so many successful models here that other schools do. One of them is the hybrid program. So for students who are interested in getting a degree remotely, they can still come to us to spend a semester or so here. So making sure that we have in-person programs, remote programs, and also hybrid programs. Reviewing our policies and procedures to eliminate barriers to applying and enrollment. Enhancing our online presence, and I really can't say enough on this. And then engaging our alumni. They are eager to help. So engage them in our marketing strategies. And then seeing what works, what needs to be improved, in order to focus our efforts where they should be, for the maximum gain in terms of enrollment. In terms of retention, support, and completion, again, improving academic advising, including targeted at-risk advising, making sure that our faculty are trained not just in advising or curriculum design, but also everybody trained in diversity, equity, and inclusion, conflict resolution, and making sure that faculty and staff are aware of the resources that we already have, because that could be a barrier that limits using these resources. Engaging and empowering the student council. Again, our students are fabulous, and they can help a lot in providing support and making the learning experience better. Creating student ambassadors. So I started this recently in EPI, where there is a student who's a liaison between other students in the program and faculty members and the program director. Students know that they are always welcome to reach out directly to faculty or the program directors. But sometimes they don't feel comfortable doing that. So making sure that there is somebody who could be their voice if needed is very important. Support groups, including a buddy system for international students, and that can go a long way in terms of support. And happy to discuss that more if folks have questions about it. And then fostering sense of community by celebrating all cultures. As I mentioned, activities that bring everybody together and make everybody feel welcome. And it doesn't have to be actual activities. Could be even a simple email sent out to students acknowledging that we know you're celebrating this and we congratulate you on this occasion. So that's all I have, and I will be happy to take questions.
Thank you so much, Dr. Abdel Maksoud. If anyone has questions, please enter them into the Q&A or the chat, and I'd be happy to read any questions out.
So if I may, can I just get us started while people are formulating questions in the chat? Medea, thank you for that presentation. It's absolutely excellent, and your passion for students really and their well-being comes through. So thank you for that.
Thank you.
I have a question. You emphasize international students and online quite a bit. One of the questions I have is that are we late to the game for online? And how do we ensure that our online programs don't undermine some of our in-person or hybrid programs? And then the second part of that question is around international students. I always hear that even if offered online, they're more likely to pick Hopkins online program. And even then, scholarships are needed and support. Can you just address some of those concerns for me?
Sure. So the first part was, are we late to the game? And we're not. What I'm working on in our department with my department chair doesn't really cost us anything. So the two classes that I mentioned, one of them is an EPI course that we already offer twice a year. So we will just simply make one of the sections online. The other class, which is a BiStat class, it has been an issue because it was only available once every year in the fall, and not every student was able to take it. So having it, this is a required course, will be very helpful anyway. So I think it just needs careful look at our programs. Again, thinking about how to do this in the most resourceful and thoughtful way. And then making sure that the target population we're trying to reach are aware that we have these programs, we're an accredited institution. From my conversations with the Kuwaiti embassy, they don't know anything about us. After we started the conversation, they reached out to me and they said they had questions, and they said, can you send us, information about this? They are eager to learn as well. There will be people who will prefer to come here in person. And we had a student, a Kuwaiti student, who came to us with a full scholarship for an MPH and a doctoral program. So this is an area that we can certainly tap into. In terms of choosing another school over us, the example that I gave was actually from Hopkins, that program that they call Online Plus. So they require only for a minimum of 4 credits to be taken in person, which I think is a pretty good idea for students who still want to feel that this is a community. I think if we have a clear focus and if we're visible, students will not necessarily choose Hopkins. Colorado is a fabulous location, and we just need to grow in terms of outreach. If we have a clear focus, if we're visible, and if we offer rigorous and innovative programs and make some of them available, more of them available either hybrid or online, I think that will be reflected in terms of enrollment.
Thank you. And sort of follow up on a similar line, I have a question here. For international recruitment, one of the biggest hurdles is tuition. Could you talk about addressing this or your thoughts? Do you see this as an equity issue?
It is an issue for sure, especially that, I can tell you how many emails I've been getting this semester from students, international students who are supposed to start in the fall, saying I have been accepted, but I don't think I can come without some kind of assistantship. I think, again, if we expand our online offerings, it will make it more affordable, because paying the tuition is something, and living in the US for a couple of years is a completely different story. So that will cut on the expenses tremendously. I think we can do more in terms of fundraising, and I have experience in this. I remember in terms of scholarships in particular, where one of my late mentors, Steve Berman, and I would go meet with Rotary chapters and talk to them about how scholarships make a difference in terms of the growth of our students, the projects that our students do abroad, and how this changes their life, how they change their lives forever as practitioners, etc. And the outcome was always positive. So I think, if we're able to provide scholarships, more scholarships, then that will be reflected in enrollment. But I don't think this is a problem that only us in Colorado are seeing. I think it's a problem everywhere.
Thank you. So we have another question. Do you have any thoughts or ideas about increasing in-person enrollment at the CSU and UNC campuses?
One of the things that I learned when I talked to my colleagues on these two campuses is visibility. So a colleague from UNC specifically told me that we're not visible. So I think that the first step will really, as I mentioned, is communication. So understanding the needs of our colleagues and working together to see what's impeding, what's impeding enrollment in these two other campuses and what we can do to increase enrollment there, without really understanding how things are offered there and what kind of marketing, and just hearing their needs. It will be hard to come up with a strategy on the spot. So we need to know what the challenges are and then work on these challenges. Visibility, as I mentioned, as I heard, is one of them, and this is something that we can work on. But we need to know what else is going on. And I have to say that even in something like EPI, we have an EPI program, and there is a EPI program at CSU. It wasn't until recently that my colleague Tracy Nelson and I connected and decided that moving forward, we need to have regular contact once every semester to be able to understand needs and work together.
Yeah. I'd also be curious to hear a little bit more about the buddy system that you're referring to, and just sort of your thoughts and sort of fostering that sense of belonging and community among our students.
So this is something that, again, I'm trying to be resourceful while finding a way to support international students. And one of them, from my conversations with students, is they have been trying to support each other. They even started a Facebook group where they ask each other questions like, where do you find housing? If I need to see a doctor, what do I do, etc. But this is really on us as a school to provide that support. So the buddy system is something that I've been thinking to implement, at least at the School of Medicine so far. And then, I have other means to support international students in my department that I've been doing. So I check in with them personally to make sure that they are supported. But it's a list of volunteer students who are willing to help. And then each time so I basically reach out to students saying, will you be able to just be a buddy for a newly arriving student? Would you be able to pick up this student from the airport? I still remember when I came to the airport here as an international student myself. Would you be able to help, exchange emails with the student before they even arrive to answer any questions they have? And I know I had a lot before I came. And just until the students feel that they are supported enough to do well in the program. So basically, somebody who's either a US student or a non-US student who's been in the US for a long time enough to feel comfortable knowing the system to support a newly coming student.
Medea, if I could shift away from students and talk a little bit about curriculum reform and that process. How would we, as you're aware, our budget model really encouraged our school departments to be very entrepreneurial in the sense of developing new certificate programs or new concentrations where the tuition-based model would come back to them to help for thriving. And now I've tried to take some of that apart and encourage collaboration. How would you go about thinking about across the board about curriculum reform, understanding, you know, that our MPH applications have gone down, whereas nationally they've gone up by 2%. We've gone down by 11% based on the last numbers I have. That may be incorrect. But how would you then help us? We've got 7 years to become much more innovative and redefine ourselves in terms of curriculum. How would we do that?
So at this stage, we really don't do much together. We don't have many classes, or at least I'm not aware of classes that we in different programs or concentrations teach together. I tried to develop a course on refugee and immigrant health, and there was a colleague from our department who was very interested in being a co-instructor. And we thought it was going to be pretty straightforward, and it wasn't. That colleague now left to another institution. We need to really encourage joint research and joint teaching. I've done this through my role at the School of Medicine, where I was able to provide a refugee and immigrant course for both med students, PA students, and dental students. So shifting from that model that you mentioned, Dee Bradley, to encourage and incentivize faculty to teach together and do research together, and even making it a prominent criteria for promotion. So just incentivizing faculty to do that in different means. And one way to do that is to really create events to bring everybody together to talk about common interests. And it's always a wonderful opportunity for faculty to catch up with their colleagues during events like faculty retreat. And we remember how much we have in common, but then this falls through the cracks. So just bringing this to the forefront, and as I mentioned, encouraging and incentivizing faculty to work together.
Thank you for that.
Sure.
We have a couple of minutes left if anyone wants to enter a question into the chat. Otherwise, I think we might be ready to wrap up.
All right. Well, thank you, Michelle. Thank you, Dean Bradley. And for everybody who's on the call, I can't see really anybody but Dean Bradley and Michelle. So thank you so much for being here via Zoom, and I hope everybody has a great rest of the day.
Thank you so much.
Bye.
Thank you.
Okay.
Bye-bye.
Bye.